So eyelid surgery can involve surgery of either the upper eyelid or the lower eyelid, called upper and lower blepharoplasty. These operations are commonly done together, but don't necessarily have to be. On the upper eyelid, usually we're removing a strip of skin and a very small amount of fat muscle from the upper eyelid. This opens up the eye, creating more space between the eyelashes and the lid fold, giving the eye a youthful, more open appearance. The lower eyelids, on the other hand, are a little bit different. In the lower eyelid, we're generally removing more fat and less muscle. Over time, there is a layer called your orbital septum, which holds the fat behind your eye. That layer gradually radially expands as we age and allows that fat to balloon out, giving us that dark circle, puffy lower eyelid look. That can really only be corrected by surgically removing that fat. You can make an incision either on the outside of the eye, just underneath the eyelashes, or on the inside of the eye. Personally, I generally prefer the incision on the inside of the eye because there's no external scar and it has a lower overall risk, and it allows us to remove the fat in just as effective a manner. If patients have a little bit of excess skin on their lower lid, while it can be removed through an external approach, I frequently prefer to use lasers to actually tighten up that skin because I think it gives a smoother, more elastic look than simply pulling on skin, which has gotten a little bit crepier and elastic. Eyelid surgery can be needed at a whole variety of ages depending upon the patient's genetics and anatomy. It's not uncommon to meet women and men who are in their 20s, still in college even, who come in saying, I have my father's eyes, I have my mother's eyelid bags, and they simply genetically have excess fat below their eyelids. So at some point there are young patients who are good candidates for these operations. Now there's a whole separate group of patients who look fine when they're young, but as they age, the upper eyelid skin gets a little bit loose and heavy, or again, the lower eyelid fat bulges. This can start as soon as 35 or 40, or may wait till they're 50 and 60. So with a lot of our operations, there's not really an appropriate age for a patient, there's an appropriate anatomy. If you have the anatomical problem that the operation is designed to fix, then you may be a good candidate for it. If you don't have the problem, regardless of your age, then you are not a candidate for it. You know, eyelids are very delicate structures, and along with our nose and our lips, they're the things that people tend to focus on. Tiny, tiny little differences of a millimeter here or there can make people look operated or a little bit strange, and we've all seen that look. And it's unnecessary, it doesn't have to be done that way. So I think the most important thing when picking an eyelid surgeon is to look at their results, look at patients they've done before, and make sure those patients do not look surgical. You do not want to have a surgical eyelid, because once that is done, there's really no good way to correct it. You can't undo